Hi, welcome to the ImmunIGY training video. The purpose of this video is to show you how to take a blood sample and run the ImmunIGY test, and we're showing you this both within a calf collection centre environment and on a dairy farm. We are first going to describe obtaining the blood sample by means of the lancet. Before using the lancet, as with all procedures, it is safer and easier if the animal is well restrained, as the less movement the animal makes, the easier it is to both use the lancet and then obtain the sample. As you can see in this video, the ideal system of restraint for this technique is where the calf's head is locked in a yoke with a nose strap fixed to fully restrain the head. But it is perfectly easy to take a sample via standard manual restraint of the calf, provided the calf is restrained appropriately. That is, the animal is backed into a corner to restrict backwards motion, and the head is well restrained by the operator. The target area where the lancet should be applied to take the blood sample is highlighted within the circle here. This being the region of very short hairy skin just caudal to the nasal planum and approximately midway between the nasal septum and the lateral aspect of the nostril. Do look to avoid the wet front of the nose, as this will result in the blood smearing when it starts to flow, making it difficult to collect. The lancet should be applied as one quick stab. On some occasions, there may be a small delay for the blood to follow. If no blood flow is detected after 20 to 30 seconds, then the lancet can be applied again. Only a couple of drops of blood are required to fill the microcapillary tube. The tube is best filled via applying one end to the flow of blood and then angling the other end downwards below the perpendicular, so that the far end of the tube is below the height of the point of collection, as is demonstrated in the video. Where the blood drop appears slowly, it is worth waiting for sufficient blood to appear before applying the capillary tube, as it is much easier to collect at this point than starting when only a single small drop of blood has appeared. The capillary tube should be completely filled to ensure a correct sample volume, taking care to avoid any bubbles or gaps, as is demonstrated here, as this will result in an incorrect volume of blood being analysed, which will lead to inaccurate results. Once the capillary tube has been fully filled, remove the lid from the buffer bottle by unscrewing the white part and insert the whole capillary tube into the buffer bottle. Replace the lid, ensuring that the lid is back on tightly, and then mix well by gentle inversion for 5 to 10 seconds to disperse the blood in the buffer solution. Thorough mixing of blood with the sample buffer is important to ensure a good result of your test. This can be determined by ensuring a uniform colour of red throughout the blood buffer mix. Following the sample being taken, the lancet should be cleansed with a surgical spirit swab between each calf, and always remember to close the safety lid to avoid the risk of accidental injury. Each lancet can be used up to 50 times before it should be disposed of. We will now describe the process of testing the sample. To perform testing, you will need a timer and a method of recording the results. From application of the drops to the lateral flow device to reading of the test takes an incubation time of 10 minutes. The following protocol is how we suggest you perform the testing. Ensure that all materials are brought to room temperature. This is important to ensure that reliable results are obtained. Then remove the LFD from the foil pouch, checking that there is no colour change in the silica gel sachet. It should not be green or blue. Place the LFD on a flat level surface, and if testing several samples at the same time, line the buffers adjacent to each LFD. It is useful to mark the LFDs with a unique identifier using a suitable marker. During this stage, it is vital to make sure that the RFID card you'll use to calibrate the cube reader has the same batch number as on the foil pouch of the LFDs you are using. The use of the incorrect RFID card will result in inaccurate results being obtained. When you are ready, remove the blue part of the dropper bottle by twisting counterclockwise to enable dispensing of drops into the sample well of the LFD. Add 3 drops of the blood buffer mix, ensuring the bottle is fully inverted, as this will ensure an accurate drop size, and leave a few seconds between each drop, ensuring that there are no air bubbles in the drops, and then start the timer. Within a few seconds, you should see a red colour move across the test window, and after a few minutes, the formation of a test line on the right and a control line on the left. Please note that the control line should always appear, regardless of the presence, absence or concentration of the IgG at the test line. If the control line does not appear, the test has not run correctly, the reader will display a fail message and the test should be discarded and the result deemed invalid. The usual cause of a weak or insufficient control line is too little sample being added to the LFD, often because of air bubbles contained in sample drops when dispensing. If you are testing more than one sample, apply the 3 drops of the sample solution to the next lateral flow device after an interval of 30 seconds and repeat this process for the further samples to be tested as necessary. When you are confident in your system, the interval between tests can be lowered to 20 seconds, but we recommend allowing 30 seconds initially to give yourself plenty of time between the reading of each sample. After around 9 minutes, so that you'll be ready to test the first LFD at the 10-minute interval, place the first LFD to be tested in the cassette holder, making sure that the device is inserted correctly such that the sample window is on the right, as shown on the picture embossed on the adapter. Press the button once to turn the reader on. The display will read on. Press the button again and the display will read RFID or card. Place the RFID calibration card on top of the cube within 10 seconds. Taking longer than this will reveal an error message, ERR, and you'll need to start again by pressing through the buttons. The display will now read test. When your clock or timer is at 10 minutes, press the button a final time to start the scan. The scan will take less than 4 seconds, then the quantitative IgG value for the sample will be displayed in mgs per mil. Record the result and move on to the next sample. For subsequent tests, you just need to repeat the process, but please be aware that you will not need the RFID card each time. Just press the button again and the cube reader will remember the current RFID card, provided that the cube has not powered down. Once the testing is finished, please refer to the IFU for the reference ranges for what is deemed good, average or deficient levels of IgG, as this will vary dependent on the age of the calf tested. It is useful to note that if the button is pressed and held for 2 seconds after a test, the result is stored within the cube reader, though no animal ID will be stored against this result. This can be recalled, time and date stamped using the data reader software, which can be downloaded from the link on the screen. This may be useful for any troubleshooting that may be required. The cube reader will store at least 100 measurements. The cube reader is powered by 3 CR2032 lithium batteries, or alternatively by a USB cable, and the cable can be useful in prolonging battery life. When changing lithium batteries, avoid handling the flat surfaces with your bare fingers, as this will potentially affect the battery performance.